Hi, good morning, everyone. So, we're going to do some sample question and answer about population health and nursing. All right, first question. What teaching method is the most effective when providing healthcare instructions to members of specific populations? A. Teach back. B. Video instruction. C. Written materials. Or D. Verbal explanation. Correct answer is A. Teach back. Question number two. Which is the most appropriate when communicating with a transgender person? A. Using identified pronouns. B. Using their first name to address them. C. Using pronouns associated with the birth sex. Or D. Anticipating the client's needs and making suggestions. Correct answer is A. Using identified pronouns. Third question. The nurse is volunteering with an outreach program to provide basic health care for homeless people. Which finding, if noted, must be addressed first? A. Blood pressure of 154 over 72 inches of mercury. B. Visual acuity of 220 over 200 in both eyes. C. Random blood glucose level of 206 milligram per deciliter. Or D. Complaints of pain associated with numbness and tingling in both feet. Correct answer is D. Complaints of pain associated with numbness and tingling in both feet. Alright, question number 4. The nurse is completing the admission assessment of a client who is intellectually disabled. Which part of the client encounter may require more time to complete? A. The history. B. The physical assessment. C. The nursing plan of care. Or D. The medication reconciliation. Correct answer is A. The history. Question number 5. The nurse working in a correctional facility is caring for a new prisoner. The client asks about health risks associated with living in a prison. How would the nurse respond? A. Healthcare is very limited in the prison setting. B. Living in a prison isn't different from living at home. C. Living in a prison can predispose a person to different health conditions. Or D. Living in a prison is similar to living in a condominium complex or dormitory. Correct answer is C. Living in a prison can predispose a person to different health conditions. Question 6. The nurse is caring for a client in the emergency department who presents with a complaint of fatigue and shortness of breath. Which physical assessment finding, if noted by the nurse, warrants a need for follow-up? A. Reddened sclera of the eyes. B. Dry flaking noted on the scalp. C. A reddish-purple mark on the neck. Or D. A scaly rash noted on the elbows and knees. Correct answer is C. A reddish-purple mark on the neck. Question number 7. The nurse working in a community outreach program for foster children plans care, knowing that which health conditions are common in this population. Select all that apply. A. Asthma. B. Claustrophobia. C. Sleep problems. D. Bipolar disorder. E. Aggressive behavior. Or F. Attention deficit hyperactivity disorder or ADHD. Correct answers are C, D, E, and F. C. Sleep problems. D. Bipolar disorder. E. Aggressive behavior. And F. ADHD. Number 8 question. The nurse planning care for a military veteran needs to prioritize nursing intervention targeted at managing which condition, if present, that commonly occurs in this population? A. Hypertension. B. Hyperlipidemia. C. Substance abuse disorder. Or D. Post-traumatic stress disorder. Correct answer is D. Post-traumatic stress disorder or PTSD. Ninth question. The nurse caring for a refugee considers which healthcare need a priority for this client? A. Access to housing. B. Access to clean water. C. Access to transportation. Or D. Access to mental health care services. Answer is D. Access to mental health care services. Alright, our last question, number 10. Which action by the nurse will best facilitate adherence to the treatment regimen for a client with chronic illness? A. Arranging for home health care. B. Focusing on managing a single illness at a time. C. Communicating with one provider only to avoid confusion for the client. Or D. Allowing the client to teach a support person about the treatment regimen. Correct answer is A. Arranging for home health care.